Hi, my name is Mimi Meriwether, and I'm the Director of Psychological Health for the South Carolina Air National Guard and the 169th Fighter Wing at McEntire Joint National Guard Base. My role is to provide emotional and psychological support to airmen and their families. I'd like to take a moment to talk with you about suicide and how to get help for yourself or a loved one. Suicide is painful to talk about and difficult to explain. For instance, some believe those who suffer from depression commit suicide. In fact, many people don't. We don't know the exact reasons why some people choose to die and others don't. Suicide and depression are complex. However, we do know from military statistics that job-related stressors, relationships, addictions, and finances can trigger the downward spiral that leads to hopelessness, which in turn can lead to suicide. How do we know when to ask a person if they're having thoughts of suicide? There are risk alerts to look for because a suicidal person may not always ask for help, but that doesn't mean help isn't wanted. Most people who commit suicide don't want to die, they just want to stop hurting. A few factors that may place your wingman or loved one at risk are as follows. Experiencing loss of a relationship, such as a death of a loved one or a divorce, employment and financial difficulties, a lack of social support, a pre-existing history of mental illness, a family history of suicide, abuse or misuse of alcohol, prescription drugs, or illegal drugs, overwhelming legal issues, or a major physical illness. Please know that at any time you may call the South Carolina National Guard Behavioral Health Care Line for immediate assistance at any time, day or night.
Hello, I'm Lieutenant Colonel Brian Bohlman, Wing Chaplain for the 169th Fighter Wing. Our members are under a lot of pressure to perform duties and meet responsibilities in their military and civilian communities, and sometimes life can become overwhelming. Believe me, terrible storms can come into our lives. Tragedy can strike a family. Financial problems do happen. Relationships sometimes go bad, and loved ones can die unexpectedly. When a person feels stuck, feeling like life just doesn't matter anymore, or when they believe there's no way out of a situation, this is when suicidal thoughts or actions may occur. The best way to prevent suicide is to identify the problems before a person gets to the point where suicide feels like the only path left. I want you to pay attention to these major warning signs. Thinking of hurting or killing yourself, preoccupation with death, dying, or suicide, self-destructive behavior such as excessive use of alcohol, drug abuse, or reckless driving, extreme behavioral changes such as mood swings, rage, or sleeplessness. Also withdrawing from family, friends, or even one's faith or beliefs, and especially hopelessness. Suicide is a major concern facing the military and their families today, and prevention starts with recognizing the warning signs and taking them seriously. If you think a wingman or family member is considering suicide, don't be afraid to bring up the subject. Talking openly about suicidal thoughts can save a life. Don't dismiss the warning signs. If your wingman, family member, or friend is at risk, help is available 24/7. Call our helplines and get connected to the services and the support that you need. The most important thing you can do to prevent suicide is talk, listen, and care. In doing so, you just may save someone's life. Remember these two crisis contact numbers. In fact, I would ask that you would store them in your cell phone. You never know when you may need them to help someone in crisis. Most of all, thank you for being a wingman to anyone in need.